So this study was done across multiple institutions in the United States. We accrue 42 patients, and we presented safety data on those 42 patients, and we present efficacy data on a subset of 30 patients who had been enrolled 3 or more months prior to the data cutoff. Our study population was patients with multiple myeloma that had progressing or were refractory to the last line of therapy. They had received 1 to 3 prior lines of therapy, and they had indication for treatment. The patients receive this combination initially on a part 1 of the study, which was dose finding. We had 4 cohorts with Venetoclax being used in 400 milligrams in the first cohort and 800 milligrams in cohort 2, 3, and 4. We explore combination with different doses and schedule of Carfilzomib, the labeled 27 milligrams per meter squared twice a week. We explored the on-label 56 milligrams twice a week. We also explored the 70 milligrams per square meter once a week, which had been previously presented as a single agent on the Champion-1 study, and was presented in this meeting as the winning arm of the Arrow study, where once a week was compared with twice a week. So we saw the combination was overall well tolerated. The safety profile was very similar to what has been seen before in prior Carfilzomib studies, but also what we are familiar with in clinical practice by using Carfilzomib. We had mostly cytopenias that were asymptomatic. We had a few cardiovascular events, including low rate of congestive heart failure and some patients developing hypertension. For the most part, the cardiovascular toxicities were reversible once the Carfilzomib was held, and some of those patients were able to resume Carfilzomib at a reduced dose. In terms of efficacy, what we found was very intriguing high rate of responses. We saw 83% response rate across the subset of patients. Keep in mind this is patients with a median of 2 prior lines of therapy, with half the patients being refractory to prior bortezomib, and 2/3 of the patients being refractory to prior immunomodulatory agents, and the majority of the patients on trial were refractory to their last line of therapy.